So today we're going to talk a little bit about some expectations after having total knee surgery at the hospital. Thank you, Denise, for joining us.
Of course, thank you, Sarah. All right, so what can I expect in terms of pain?
All the anesthesia that you're going to be receiving at surgery will kind of wear out of your system anywhere between kind of 12 to 36 hours or so. You may have an increase in pain thereafter. That's normal. While you are at Sibley, they're going to help manage your pain. Then when you're discharged, we're going to talk after this video about some medications that can help mitigate your discomfort. Additionally, I want you to kind of know that it's common to have some swelling at the site. Swelling does peak around 2 weeks and it can go into the lower leg, so into the ankle. That's common. That can take several weeks to months to fully resolve. It does get better. What you'll also see is some bruising. Bruising can come above the knee as well as go below, so don't be alarmed. That's going to get better a lot quicker than the swelling will.
Okay, and what about my incision?
It's going to be covered with a waterproof dressing, so you're going to be able to shower even the night after surgery. The dressing will remain in place for a total of 2 weeks. We see you back at the 2-week mark to get x-rays, see how you're doing, and then remove the dressing. It's common to have some discharge on the dressing, but if for some reason it becomes more than halfway saturated with blood, water, or any other fluid, do give us a call. We'll have you come in for a dressing change.
And when should I expect to start physical therapy?
So Sibley will actually help initiate the physical therapy process. They will help start that process once you're admitted. So don't be alarmed if you haven't heard anything from them prior to this. They will have in-home physical therapy come into your home for about 2 to 3 weeks, and then most patients will transition to outpatient therapy at that time.
Okay, any activities I can or can't do?
So you're going to be fully weight bearing. The hospital will give you a walker. You're going to progress from a walker to a cane to without anything, completely at your own speed. So physical therapy will also help guide this. In terms of sleeping, you can sleep in any position. We just ask that you don't put a pillow directly underneath the knee. You can put a pillow on the side, in the calf, or the ankle, that's fine, but just not directly underneath.
Okay, and any tips for blood clot prevention?
So we want you to wear compression socks. Compression socks are worn for the first 4 weeks on the surgery leg, and on the non-surgical leg for 2 weeks. They do come above the knee, so they are quite long, but that's to help not only with blood clots, but as well as swelling in the knee.
Okay.
Then we will also put you on likely a baby dose of aspirin to take twice a day for the first 30 days. We couple that with protonics just to help protect the stomach lining. If you do have a history of a blood clot, a PE or a DVT, we may have different regimens of medication that we'll put you on, so please let us know.
Okay, good to know. And what about my follow-up appointments?
So we have several different intervals we see you back, both to see how you're doing as well as get updated x-rays. We'll first see you at the 2-week mark, then we'll see you at the 6-week, the 4 months, and then the 1 year.
How soon can I visit my dentist?
We have you wait a total of 3 months till after surgery to do any dental cleaning or procedures. And now, because you will have an implant, we want you to have a discussion between our office and your dentist's office to determine if prophylactic antibiotics are warranted prior to further dental procedures or cleanings.
When is it okay for me to call the doctor?
Well, first of all, we're here. So if you have any questions or concerns, do give us a call. Reasons to definitely give us a call are if you are suddenly unable to bear weight on that leg, fever above 101, severe pain, significant nausea and vomiting. Again, give us a call.
Great, well, thank you so much.
Thank you.